Lasers are basically concentrated forms of light energy that can be used to deliver skin changes. And what it can be used for really is to help refine and change the way that the skin actually is looking and functioning. And that can yield a variety of different benefits.
So here I am again. I want to look 29 still. I got my Botox or my botulinum injection, my wrinkles now look a bit better, but I want my skin to look a bit younger. Lasers play a role here?
Absolutely. So there are different lasers and light-based devices and energy-based devices that can be used alone or in combination to help patients get their best skin. And what I oftentimes recommend is that patients come on in, again, to see a board-certified dermatologist, someone who specializes in aesthetics, so that they can have a consultation, so that they can be thoroughly evaluated, so that we can hear what the patient wants, what the patient is looking to achieve. One of my approaches to skincare and to the consultation whenever patients come in to see me is I really listen. I sit down with them. I really want to hear what their goals are, what their hopes and what their dreams are. This is their chance to really tell me and share with me what they would like to achieve and what they would like to enhance or refine, versus me sharing what my thoughts are. One of the things I like to do during the consultation is I oftentimes give the patient the mirror. And this is their chance, really, in an uninterrupted manner, to really take a look at themselves and decide what would they like to focus on for that visit. And then we put a plan together.
So I can't just pull up the mirror and say I want to look 29 still. I have to.
Well, I want to hear some of the different things that really you're focused on, not just age and not just a number, but how can we work together, because this is going to be a partnership, a relationship, to help you achieve whatever your goals are.
So that brings me to the next conversation, which is if someone walks in and says in the mirror, I've got a little scar here. Mm-hmm. Because there are plenty of people who have fallen down and had sutures put in, stitches put into their face or somewhere else in their body. And we hear a lot about this, of scarring. And people would like to have scars removed just like they have tattoos removed. Does laser play a role in this? Can you treat scars like that?
So absolutely. There are different lasers that do play a role in scar treatment and scar rehabilitation. One of my favorite lasers is a fractionated carbon dioxide laser. That's a class of laser that really vaporizes small pixelated matter on the skin to help promote younger, fresher skin to kind of regenerate in that place. And that's really the gold standard for the treatment of scars today. This really segues nicely into one of the other things that I'm so excited about and passionate about is the research that we've been engaged in for the past 10 years. This research started off at SUNY Downstate and continued on after my residency to the University of California, where we were engaged in research for 7 years focused on how can we treat scars in a non-invasive, easy way for patients that they can engage in this therapy at home.
And so they don't have to go under the knife.
They don't have to go under the knife or under the laser. So
tell us about this.
So let me tell you, one of the exciting things is that, with this NIH-funded project, because, we had such exciting laboratory data that, was generated by the team of wonderful medical students, research fellows, and other faculty members who were colleagues.
And you.
Thank you.
Very important for our viewers to know you were a key role in this study.
Thank you. We as a team, but it's all about the team, because no one person really can advance science by themselves and advance medicine by themselves. And by working together as a team, we were able to discover that using light, visible light at different wavelengths, we were able to change the way that the skin cells function that generate the physical characteristics of scarring. And by looking at this in the laboratory and studying some of the molecular findings, we were actually able to then translate that into a clinical trial, which is now ongoing at the State University of New York, where we are using red light-emitting diodes, red LEDs, to see and study if we're able to decrease scarring in patients after surgeries.
I know our viewers are saying that was a lot of technical jargon, but it sounds like to me,
Tell me.
You're able to start treating scarring or prevent scarring using just various wavelengths, different colors of light, not even lasers, not even going under the knife, which is incredibly minimally invasive.
Right.
It's really just not invasive.
Right.
That's really nice to hear. And this research is going on here in our hometown.
In Brooklyn.
In Brooklyn. Unbelievable.
So, SUNY Downstate.
SUNY Downstate, Brooklyn. You have some of the most advanced research going on in skin health, skin care. And so you're over at SUNY Downstate now with this new institute that you were part of starting. You see patients there?
Absolutely. We're seeing patients there for this clinical trial, and we're going to open up the larger institute hopefully early next year.
So patients out there who are thinking of having their scars treated one way or the other can consult with you possibly.
Absolutely.
And see if they're a candidate or see
Absolutely.
whatever options you can provide as an expert in treating this. So we talked a bit about sun health, avoiding the sun, or at least wearing sunscreen, proper sunblock, blocking clothing is also important. We talked about that because that could prevent the aging process a little bit, prevent people from having bad skin going forward by blocking the sun now. We talked a bit about injections that you can use to make me look 29 still. And we talked a little bit about lasers and now light. So there really seems to be a lot in the toolbox these days to treat people who want to take care of their skin, take care of blemishes, scars. Tattoos. These can be removed now.
Absolutely.
How do you do that?
Different laser wavelengths, different types of light that are used via a laser device can remove tattoos. These wavelengths are specific to each color in the tattoo, and therefore you may need different lasers to remove different colors. But this happens over a series of treatments, usually 8 to 12 treatments, spread out by a month apart. And then these lasers kind of focus the beams onto the tattoo colors and pigments in the skin and kind of gently shatter those pigments until they're so small that they're finer than a grain of sand and they can't be seen by the eye.
So if I had a tattoo that says, "Love Jenny forever," and then Jenny stops loving me forever, you can remove.
We can remove them.
And if I find someone else, they can replace the name in the same area.
Absolutely.
So it's sort of like cut and paste or delete. These are things that we thought years ago you couldn't remove, and now
Now with technology, here we are. We're able to do a lot of things that really help patients achieve their best lives. And when patients have tattoos that they're ready to get rid of and ready to move on from, we're here for them. And that's one of the things that we're excited to offer at the SUNY Downstate Laser Aesthetic and Body Institute.
So it sounds like the laser is really taking up many, many roles. Light therapy is taking up many roles. And we've seen light therapy used in other diseases in medicine, and here you are expanding it here in Brooklyn, incredibly, at the SUNY Downstate Medical Center at your institute there. In terms of cosmetics, if somebody goes for plastic surgery, if someone goes for some of these laser therapies, what are some of the potential side effects that they should look out for? What are some of the downsides? We talked about all these wonderful benefits, but fair and balanced, we should at least talk about what are some of the side effects that could occur.
So there are different side effects that can occur with laser therapy. Blistering, the sensation of a burn is the most common. Those usually resolve without any scars or problems. Just downtime. One of the things that every patient should know is that there's going to be some downtime with almost any laser procedure, whether or not that downtime is an hour or two of redness versus wound care that has to be taken care of in terms of helping the skin heal after the laser procedure so that patients can achieve their best and most optimal outcome.
So these are an important conversation that patients should also have with their doctor. It's not just how good can you make me look,
Absolutely.
How great will I be after this, but always to ask about what are some of the side effects. Will I be able to go to work the next day?
True.
And I'm sure that after some of these therapies, they can't go out in the sun possibly for some time. So
for
maybe
a few days.
Right. So maybe if you've got some weekend plans out in Jones Beach or something, maybe not having a laser therapy done on Friday is a good idea.
So that's one of the most important parts of the consultation is really sitting down with the physician, chatting with them about, chatting with the patient about what their needs are. And when you both come together, patient and physician, on what your needs and what your goals are, then you put together a timeline, a treatment plan. And that always needs to include what sort of downtime there is, what the possible risks, benefits, and alternatives are.
And this is a conversation that is classic between patient and physician with all medical therapies, and that's why it's important to see a physician, a doctor, because they also provide full thickness care. They understand not just the skin, the injection, the laser, They understand all the diseases you have and how those diseases can also play a role, the medicines you take. And so when we see somebody who may not be a medical professional or a physician, we may be taking a gamble. And a board-certified dermatologist like Dr. Jagdeo should be the next step when someone says, I'd like to have a skin therapy done to remove a tattoo or to treat a scar or to make Dr. Braha look 29 again. I'm only going to you.
Thank you.
I'm biased because I know you for 10 years now. In full disclosure to our viewers, we've known each other since we were training.
Absolutely.
We met together in Brooklyn. We've been friends ever since, and I have the highest respect for you.
Thank you.
And what you and your colleagues are doing over at SUNY Downstate Medical Center in the dermatology world. And I want to thank you so much for being on the show. It's nice to talk about this. Tends to be a happy topic in medicine.
Thank you.
People wanting to look 29 again, which one day I will look 29 again, and you'll probably be the only person who can do it, I imagine.
Come see me.
You or one of the magicians out there, but we can work on that. So I'd like to thank you for watching this episode of Medcastplus. I'm Dr. Jack Braha. It's been a pleasure to have you here watching our show with Dr. Jagdeo, an expert in laser skin care. You can follow him on social media, Dr. Jared Jagdeo. His name is at the bottom of the screen, Jared, J-A-R-E-D, Jagdeo, J-A-G-D-E-O. You can also find me on Instagram at GIJack. If you have any interest in our show, you can visit our website at medcastplus.com, check out our tools, and connect with us on social media. You can also reach us at 718-510-2103. I'm Dr. Braha, and from all of us at Medcastplus, stay healthy. Thanks for watching.